Morning, everyone. I'm Dr. Priyanka, and today's topic is on Introduction to Fixed Partial Dentures. Okay, so coming to the learning outcome. So there are three learning outcomes. Okay, so first is describe the fixed partial denture terminologies. So there are a few words which you should be aware of. Explain the parts of an FPD. Discuss the indication, contraindication, advantage, and okay, coming to the introduction. So, fixed prosthodontics consist of restorations or replacements of teeth with artificial substitutes that are attached to the natural teeth, root, or implant, and that are not readily removable. Okay, so they are fixed. Okay, so coming to the definition according to GPT, that is glossary of prosthodontic terms. A partial denture that is luted or otherwise securely retained to natural teeth, tooth roots, and or dental implant abutments that furnish the primary support to the prosthesis. Okay, coming to the functions of fixed partial denture. So it provides proper occlusal function, maintains arch integrity, tooth position, maintains occlusal relationship, protects and preserves the remaining structures. Okay, so basically occlusion is the main thing which it does, and because of that it also protects and preserves the remaining structures. Okay, coming to the indications of fixed prosthesis. So one or two adjacent teeth are missing in the same arch or short span edentulous arches. The supportive tissue are healthy. Suitable abutment teeth are present. So the patient is in good health and wants to have the prosthesis placed. The patient has the skills and motivation to maintain a good oral hygiene and according to the patient preference. Okay, coming to the contraindication for fixed prosthodontics. So necessary supportive tissues are deceased or missing. Okay, so that obviously means the teeth or the abutment teeth adjacent to the place where the replacements has to take place. Suitable abutment teeth are not present altogether. Okay, so not present, deceased, missing, patient in poor health, patient is not motivated to have the prosthesis placed, patient has a poor oral hygiene habit. Okay, so patient is not able to maintain the prosthesis. Okay, coming to the advantages. So replacement teeth are fixed in place and provide a stable and natural looking alternative to a removable prosthesis. So it's basically fixed. Yeah, and the aesthetics are good. Okay, so it's a more natural looking alternative. Okay, so again, good aesthetics, good function, and it preserves the arch form, and of course it maintains the occlusion. Okay, coming to the disadvantage. So margins along with poor oral health care increases the risk of recurrent decay in periodontal disease. So this is the main reason of failure in FPD. So the abutment teeth have to be maintained properly. Okay. Difficult to keep clean. Yes. There are measures which you can take. Okay. There are interdental brush which you can use. Sometimes according to the pontic design, things get difficult to clean. Yes. FPD can compromise the abutment teeth, increasing risk for future root canal or tooth loss. Yeah, again, the abutment teeth. So we need to maintain the abutment teeth in a healthy condition. Okay, so it should be away from RCT and away from periodontal diseases. Okay, it is not indicated if restorative and periodontal condition of abutment teeth is poor. Okay, so if it is already decayed or it's in line of going towards the decay, then it's not indicated. contraindicated, okay? And then there can be a problem, okay? Okay, guys, so coming to other common terms which are used in relation with an FPD, which you should know: crown, laminate veneer, facial veneers or facial veneers, inlay, onlay, abutment, pontic, connector, retainer, okay? So we'll be just seeing these briefly, guys, okay? So crown, it is cemented extracoronal. It is a cemented extracoronal restoration that covers or veneers the outer surface of the clinical crown. Okay? And the primary function is to protect the underlying tooth structures and restore the function. Okay? Restore the function, form, and aesthetics. So basically, again, we have to restore the function, form, and aesthetics, okay? Okay, so there are multiple types of crowns. So there is a full veneer crown and partial veneer crown, okay? So in partial veneer crown, there can be many types, okay? So three-quarter crowns, it can be both in anterior and posterior teeth, reverse or most commonly called as modified three-quarter crown, which is for the posterior teeth, 7/8 crown, which is for the posterior teeth, pin ledges is for the interior, and inland only, okay? So this is a completed mandibular posterior 3/4 crown preparation. Okay, so you can see that you have left the buccal surface intact and only the occlusal surface, the incisal edge, the occlusal edge has been prepared together with all of the other margin has been prepared, okay? And ledges have been created on both the sides, all right? For retention, guys. So this is an example of three. Again, three-quarter crown in other views looks like this, okay? So there was the preparation, the buccal or the facial surface remains intact, okay? And the rest of the surface is prepared and fixed on. Okay, coming over to the modified three-quarter crowns. So it's indicated in case of lingually inclined teeth, okay? And when the buccal wall are disrupted due to caries or trauma with the lingual wall intact, okay? So this is an example of a modified three-quarter crown, guys. Okay, and the 7/8 crown preparation. Okay, so a little bit of the tooth structure remains, and all of the structure is prepared and ledges are created to place the crown, mostly done in the posteriors, guys. Okay, coming to a laminate veneers or facial veneers. So this what do you call a veneer? Okay, placed onto the teeth. So these are very thin and it's only prepared on the facial surfaces. Okay, very thin preparation is done. So very less preparation, I'm sorry, is done. So a laminate can be cemented onto this tooth structure, okay? So it consists of a thin layer of dental porcelain or cast ceramic that is bonded to the facial surface of the tooth, okay? It is used in situations requiring an improved cosmetic appearance on the anterior teeth, usually indicated for improving the cosmetic appearance, guys. So people get it done from 3 to 3 or 5 to 5, meaning premolar to the first quadrant premolar, like 1 5 to 2 5. So basically they see the smile line and they see which are the teeth which are visible in the smile profile, and only the teeth visible, they get the veneers done. Okay. Okay, so here, this is the veneer. Okay, coming to an inlay. Okay, so you can see this is an inlay, so it's gonna go on top of the surface. Okay, so it's a fixed intracoronal restoration, a dental restoration done outside of the tooth to correspond to the form of the prepared cavity, which is then luted onto the cement. Okay, this is done outside and then it's fixed inside. Okay, inlays are similar to fillings, but the entire work lies within the cusp on the chewing surface of the teeth. All right, so usually only on the cusp region. Okay, occlusally, guys. So yeah, it is used for restoring more extensive damaged posterior teeth needing wide mesio-occlusal distal restoration. Okay, so it's like a big MODO like that. Yeah. So these are onlay. They go on top. Inlay goes inside, like on the inner surface. This is on the cusp. Okay. Also restores the occlusion. Yeah. Right. Okay. So now coming to the parts of fixed partial denture. Okay, this is the pontic. Okay, so guys, first of all, this is the edentulous span. These are the abutment teeth, which we prepare to put the bridge, right? So we have done an abutment preparation, guys. This is the edentulous ridge. This is the span, okay? This is the abutment, yes, abutment teeth. So the pontic is the portion of the bridge which replaces or goes in the edentulous area, all right? So pontic goes here, okay? So retainer is material inside which joins the components, okay? Yeah, and inside here is the connector which connects two of the components, all right? So basically connector, pontic, retainer, abutment, and the framework, of course, right? So which can be made of different materials, so that should be known, and this is the edentulous span. Okay, coming to the abutment. Okay, so abutment and the pontic, guys. Okay, so this is the abutment which is prepared. Okay, a tooth or a portion of the tooth or that portion of the dental implant that serves to support or retain the prosthesis. So the prosthesis sits on top of these two pillars, or obviously teeth, which act like pillars known as abutments. So type of abutments, there's tilted abutment, there is cantilever, okay? So only supported by one side, then pyre abutment, and then there's a post and core abutment, all right? So this is the pyre abutment, so it replaces multiple missing teeth, all right? And it's a long unit. Sorry. Post and core abutment, yes. That means it is post and core treated. Yeah. And root canal and post and core treated usually. Okay, coming to a retainer. So any dental prosthesis that is luted, screwed, or mechanically attached or otherwise securely retained to natural tooth, root, or dental implant that furnish the primary support of a dental prosthesis. Okay, so yeah, and Pontics. Pontic is an artificial tooth on a fixed dental prosthesis that replaces a missing natural tooth, restores its function, and usually fills the space previously occupied by the clinical crown. Okay, so this is the pontic, which replaces and sits on top of the edentulous area. All right, and is connected and sits on the abutment teeth, guys. Yeah. Okay. So lastly, coming to the connector, all right? So the portion of the fixed dental prosthesis which, yeah, that unites the retainer and the pontic, okay, is known as the connector. So this is the connector which comes in the between the retainer, yeah, retainer and the pontic. So this is the connector, okay? And this whole unit will go sit on top of the abutment teeth and create a 3 or 4 unit bridge. All right, and then comes there are types of connectors, guys, which are rigid, non-rigid, and in rigid there are few examples, that is cast connector, um, welded connectors, loop connectors, right? So loop is the one which is commonly used. So loop connector, and in round ridges there is talon, mortise connector, split pontic connector, cross pin and wing. So there are a few. So anyway, we'll be talking in detail about all these topics, retainer, connectors, right? In next coming lectures, guys. All right. So thank you so much for patient listening, guys. And if you have any questions, I'm always in the Prosto Clinic, Polyclinic 3 in Prostofloor, and for the reference textbooks for the topic. So basically, fixed prosthodontics standard reference textbooks are Schillenberg and Rosenstiel, guys. Okay, so these are name of the authors, and kindly refer to this, read, and for further queries and question, you can come and see me in the department. Okay, thank you so much.